3, 2, 1.
Alright, hello Ma'am Susan. Again, I am Ana Luis V. Batalya and I am from BSN 3, Block A. And for this video, I will be performing the sputum specimen collection. Now first, let us define what is a sputum. A sputum is actually a deep cuffed phlegm that is submitted for laboratory diagnosis. Now this laboratory diagnosis is submitted for the purpose of identifying predominant organisms which might be causing respiratory diseases, if there is any, in the client. And before I start off, I just want to inform you that in this video, I will be tackling about the equipment, and then after that, we'll proceed with the main procedures for this process. Now, let us talk about the equipment. So when we say equipment, this actually refers to the things that we will be needing for this kind of process. Now here we have the gloves. I really don't have any medical gloves in here at my house. It's out of stock currently, so I decided to improvise. So we need to have our gloves for the nurse, and then of course I have here my face mask. Again, it's for the safety of the nurse. And then here I have my glass of water, so my patient will be using this later during the procedure. And then I have here my emesis basin, so this will be the container that I will be needing in order for my patient to release the liquid or release the washed water later. And then I have here my container. It's again improvised, so I placed a paper on the outer side of the container because I will be writing here the important details during the procedure. And then it should be wide open because you want to make sure that when the client spits out the sputum, it won't actually overflow or mess up. Then here I have my small plastic bag. So again, it's for the container of this one when the nurse decides to take it to the laboratory for testing. And then of course I have here my tissue paper, just in case my client needs it for wiping her mouth. Alright, so now let's proceed to the main procedure. So first of all, I will be doing the pre-assessment just to make sure that my client understands what we will be doing during the procedure and to establish rapport. That's actually the essence of the assessment. So first, as a nurse, I will be checking the physician's order, and then just to make sure that I will be pretty sure of what I will be doing, as well as the procedure or the test that I should do in order for me to facilitate the process. And then also I will note the client's diagnosis and tolerance to the procedure. So, ma'am, can you actually cough off or spit off your sputum po? Okay. So you need to make sure, you need to confirm if your client can actually tolerate the procedure. And then after that, I will also assess the client's ability to follow instructions. So, ma'am, kaya naman pong sundin kapag sinabi ko kanina ubo po, kaya naman po. Okay. So, after you have confirmed these things, you're already done with the assessment part of the procedure. Now, we will proceeding with the planning. Now, you need to determine if there are any special needs of the client, and then determine what type of sputum examination is required, and of course determine and obtain article that is needed. So that is what you need to do when you are about to proceed with the process. Now, you may ask the client, so ma'am, wala naman pong ibang ikaw kailangan gawin, wala naman pong iniwan yung doktor na kakailanganin yun yung iba para sa test. Okay. So, now, after this, we will now proceed with the implementation of the procedure. Now, first, I already have worn my face mask. because this will serve as my protective device. This is for my safety, just to make sure that I will not be inhaling any microorganisms or whatever bacteria is present during the process, especially when she spits out the sputum. Okay? And then next, I need to identify my client and explain the procedure. So, ma'am, again po, good morning po. Ako po si Ana Luis Vivatalia, and ako po ang inyong student nurse for today. Ang gagawin ko po ngayon is kokolektahin ko po yung sputum ninyo, yung plema po ninyo, kasi isasubmit ko po siya for laboratory diagnosis para po malaman natin kung ano po ba yung nagkukos noong problema ninyo ngayon sa respiratory ninyo. Okay lang po ba yun? Okay po. And then, after that, of course, another thing, you also need to make sure you need to identify your client. So, after that is, you need to provide privacy. Okay? So, in my case, I have already closed the blinds behind my back. And then, I will assist my client to sitting position. And again, for this video, my client is already in her sitting position because it's not contraindicated. She has no problems in breathing when she's sitting. And then, after that, I need to instruct my client to rinse her mouth. And we will be using again the plain water. So, it should not be any kinds of mouthwash because you don't want to destroy the microorganisms that's actually present in the mouth, or just to make sure that it will not be affecting the accuracy of the results. And also, you need to make sure that it's clean. So, ma'am, muna po, wash muna po tayo ng bibig. Kailangan po kasi natin mag-wash para po kung meron man, kunyari kung kumain man po kayo kanina, siguro po nag-snack kayo, matatanggal po yung mga dumi sa bibig. Yan, para clear po yung makukuha nating resulta pag nag-spit out na kayo ng sputum. And then after that, just give her the MS's basin. So, and dito niya ilalagay yung iluluhan niya. Okay. Now, after this part, what I want her to do is to instruct her to cough deeply, in order to back up lung secretion, and then to make sure that I will be really collecting the sputum. Okay, so I will be readying the sputum container, and then instruct her to do it. So before everything else, I need to make sure that I will be wearing my gloves for this procedure, because it's about time that I will be instructing my client to do the spitting out of her sputum. Okay, so ma'am, ngayon po ay mag-instruct ko po kayo na yung ubo nyo po ay yung ibigay niyo talaga yung ubo ninyo, so hindi lang siya yung parang dito lang sa lalamunan. So yung ubo ninyo is talagang deep para po mahakat yung plema, para po yung talagang sputum po ninyo yung makolek natin, and hindi lang yung laway kasi yun po talaga yung kailangan nating makolek para sa laboratory diagnosis. So okay na po, ready na po. Sige po, ito po yung container, ma'am. Ito po natin ilalagay. Dito po ninyo iluluha yung magiging plema ninyo. Sige po. Sige, so sige po. Okay po. Ayan. So after that, what I need to do is to cover the container, label accurately, and place it in a small plastic bag. So, ayan. I will be labeling the container. Ayan. And then make sure that you will be covering it properly, because you don't want it to be exposed on the environment that can actually contain different viruses, bacteria, or other organisms that can actually affect the current condition of the phlegm. Because if that happens, you will be getting a not so accurate result. So after that, I have already labeled it. I will place it inside the plastic bag, and it's already prepared, or it's already ready to go. Yeah. Then after that, what I will be doing is to remove my gloves, and then make sure to dispose it properly, and then after that, what I want to do is to wash my hands again. So you need to wash your hands before and after to control microorganisms from spreading. And then I will send the specimen promptly to the laboratory. But before I proceed to this, I need to make sure that I will be proceeding with the evaluation on the proper process. So first is I need to make sure that my client is able to oh my god. So for this process, for the evaluation, before I proceed with delivering this to the laboratory, first is, of course, I need to evaluate my client's respiratory status, if it was maintained during the process. Okay? So, ma'am, okay naman po yung paghinga ninyo. Hindi naman po kayo nahihirapan huminga pagkatapos ninyong ilabas yung plema? Okay po. Ngayon po, okay pa rin po yung paghinga? Hindi po nahihirapan? Hindi po masikip ang dibdib? Okay po. And then after that, I will evaluate the specimen collected. Ayan. So, here's the specimen. I will just check. And then after that, for the documentation, this is the last part. Okay. For the documentation, I need to record the following. The time the specimen was collected and when it was delivered to laboratory. So, it was collected early in the morning. It should be like that. So, I will record here. It's 5 a.m. And then, what time it was sent to the laboratory. So, later I will just place it in here. Then, I will explain or cite the description of the sputum. If there is any difference in the color, texture, or if it has any blood on it. So that's it. You need to take note of that as a nurse during your evaluation and documentation. And then after that, I will collect the respiratory status of my client. So just like what I did earlier, I will ask again if she was able to breathe properly during and after the procedure. And if she has no problems in breathing, then we're good to go. So that is how you do this sputum specimen collection. And I hope that the video was educational, and I hope that it was clear, although I have my equipment's not that ready kasi it was out of stock. Okay, I wasn't able to buy outside, but I really hope that I was able to perform the process properly and accurately. And that's all for this video. So thank you very much for watching, and again, I am Analysis Italia. Good morning.